Life update plus I'm entertaining one question about genetic testing. So let's get to it. So my next few checkups with my onco, radio onco, breast surgeon will all be by June. However, because my liver is still fatty and it's still fattening up, not just kidding, and we have to address that. So I got my referral letters from my onco to get checked and get managed by a gastroenterologist so that we can try to manage the fatty liver, because it might be triggered by my tamoxifen. That's one. And then I don't know if it's just because of the weather or I really don't know, but I have been experiencing some allergies, and I don't know if it's because of, again, tamoxifen, or maybe just because of the weather. I really don't know. Or maybe something that I ate. But because it's reoccurring, almost like in a week it happens. So yeah, I get this, another referral letter to an allergologist, which is very hard to book. So now going to the question about the gene testing. So for some doctors, they will just request for the BRCA testing. It's BRCA1 and BRCA2 and by Google. So those are genes. They are tumor suppressor genes that, when mutated, significantly increase the risk of breast and ovarian cancer. But for me, I had the privilege of being able to get recommended to a genetic counselor. So both my oncologist and also my breast surgeon highly recommended for it to be done, and rather than doing BRCA1, BRCA2. So I spoke to my genetic counselor, which is Dr. Maam Tumulak, and we actually did a multi-cancer panel. So it's not only one, it's not only two, it's not even 10, it's a 70 gene panel that they tested. So overall, this is, I printed it, I actually have printed it out because I normally discuss it with some. And this is the list, a very long list of all of the genes that got tested. And my results, negative. So about this test, reading just through it, this diagnostic test evaluates 70 genes for variants that are associated with genetic disorders. Diagnostic genetic testing, when combined with family history and other medical results, may provide information to clarify individual risk, support a clinical diagnosis, and assist with the development of a personalized treatment and management strategy. So, because this test did not identify any pathogenic variants known to cause disease, but this does not exclude a genetic diagnosis and should be discussed still with a healthcare provider. But in short, the risk. So we're just mitigating risks when it comes to potentially having other cancer happen is pretty low for me, because I actually tested negative for my multi-cancer panel testing. So this is always the one that I have been talking about, that I did the Angelina Jolie move, because this is also the same test that she did and she actually did preventive measures wherein she took out these and took out that. So yeah. So if you or any member of your family just wants to mitigate that risk, and maybe, for example, you have a family member who has cancer, may it be a second-degree relative or what, I mean, if you would want to do this, like it's like a genetic risk assessment, do it. So let me know. Again, if you're from the Philippines in Manila, I can give you the details of my genetic counselor, and you can actually book a session with her so that you can actually decide if you actually want to go through it. Because mind you, cost-wise, it's almost the same cost if I have done the BRCA1 and BRCA2 in a private hospital, like a tier 1 private hospital. So yeah, but yeah, that's what I did. And you can actually also go through the website of Invitae, because that's where all the different other tests that you can actually do when it comes to your genes. Yeah. And then your blood gets shipped out of the country. That's it.